should we make, I think maybe people have changed their mind because it's such a lovely evening. So anyway, welcome everybody for joining us this evening. My name's Di Billingham and I work in the public health team at Gloucestershire County Council. And the purpose of tonight's community webinar is to just have a conversation about, particularly around Matson, Robinswood and that area, in terms of how it's been for people living there in terms of complying to the guidance. As we all know, the rates are going down across the whole county, across the country, you know, but obviously we're still going to be in having to comply with measures for some time to come, despite the announcements today. So what we thought we'd start off with is with my colleague Miranda's going to make a presentation showing some of the data for Matson and some of the changes that we've seen during the lockdown period. So I just noticed that we've got a few more people joining. So if we just wait until they all are ready to go. Hello.
Hello.
Hi, Ian. Nice to meet. Nice to meet. Right. Sorry, my name's Di Billingham. I'm a public health Gloucestershire County Council. I was just introducing myself and saying. So we're going to listen to a presentation from my colleague Miranda, who's a health protection practitioner with the COVID hub team at Gloucestershire County Council, and it's going to be a real focus on what the data has been telling us for your locality and area, and looking at how things were in January, and then looking at the most recent data. And then we would like to have a conversation with you to hear about what you've been hearing from the people that live in your communities and what's been difficult, what's been hard, and how we can work together even more to try and help them get through the next phase of the pandemic, because, you know, clearly things are still going to be quite tough over the next few months, and perhaps also to hear about some of the work that you're doing at, say, at the Redwall Centre or other projects in terms of what you've already been doing, because I've been hearing about quite a lot of innovative stuff that's already been happening. So if I hand over to Miranda, who's got a short presentation.
Thanks, brilliant, Di. So I'll wait for that to come out on the screen. Hope you can all see the slides. So I'm going to just go through a bit of the data, all publicly available on the government site, and we can share that address with you afterwards. I'm sure some of you are probably familiar with it already. So if we go to the first slide and talk about just Gloucestershire. So this is a new interactive map that they brought on some weeks ago now. I thought I would just show Gloucestershire, and then we can go into a little bit more detail. So this is the 7-day rolling rate of new cases. One important note to mention before I go any further is just to say that the most recent data is always a few days old, and this is because of the time it takes for the test to be processed and results reported. So bear in mind, this isn't sort of exactly, but we can give certainly a good idea of cases up until this date. And this data refers to specimen dates. So these are tests that have been done both within the NHS under Pillar 1, but also the mobile test sites under Pillar 2. And they're lab confirmed cases. And if you can click on different areas of the map to find out what the rates are. So for this particular one, you will see that up until the 16th of February, for the 7 days previous, we had total number of cases was 386. And as Di mentioned, this is a reduction, a decrease in more than 30%, which is really excellent news. And then if you look on, you can see that the actual area of Gloucestershire is shaded in green, but obviously when it goes to blue and then purple and black, that's where the rates are much higher. Okay, so then that's, if you go to the next slide. Now I wanted to show you this to show how much it's gone down. So this is taken from the week ending the 2nd of Jan. So the end of December up until the 2nd of Jan. So it's around 6 weeks ago. And this is the highest point of this current wave. And as you can see, we are now Gloucestershire, a darker shade of blue. At that time, we had more than 2,000 total cases in the county. And so we were starting to see the impact of what happened at Christmas. And this was an increase of 60% from the previous week. So this really was the peak of the current wave. Now, if you go to the next slide, you'll see I've focused the map onto Matson and Robinswood, because this is where hopefully the bulk of the people are from. And this is, again, 7 days up until the 16th of February. And you can see that it's gone down to just 4 cases, and it's a massive decrease of 50%. So all those social distancing, abiding by the rules has really paid off. And you can see that we just have a kind of rolling rate of 44.8. And I thought it would be useful to see, if you look at where I've circled in red, the grey line shows the national average. And you can see that the small square right in the blue, that's what Matson and Robinswood. So way, way below average, which is really, really excellent news. If you go to the next slide. So this shows where we were back in the week ending the 5th of January. As you can see, we're well into the purple. There were 56 cases in total in Robinswood and Matson, with a rolling rate of 625.5. This is just to show you how quickly the virus was spreading locally at that time in January. If you go on to the next slide then. So if you're interested, you can actually sign up to the Gloucestershire County Council's Twitter feed, and they put up these daily updates for Gloucestershire. It doesn't obviously give the detail of Matson and Robinswood. You would need to go onto the interactive map to get that. But if you wanted to see on Twitter, you can just sign up. Again, the URL is at the bottom of the slide, which we can share afterwards. So then I thought I would just go through just a few points on what has helped and what will continue to help, because we're absolutely not through it yet, as we all know. If you go to the next slide, just what can we do to help our communities safe? So first and foremost is the testing. So get tested when you show the symptoms, and we're all familiar with the symptoms, and there are other symptoms that lots of people in the community have faced. But the main symptoms are, as you know, the continuous cough, the high temperature, and the loss or change in your sense of taste or smell. There's also a second titer test. So there are two tests that you can take. The PCR test, which is sometimes called a swab test, and this has been available since the summer, and it's available to anyone who has symptoms of COVID-19. And as you know, there is a drive-through site at Hempstead Meadows in Gloucester, and there are mobile sites around other parts of the county. And the PCR test is a gold standard for testing, where the results need to go to a laboratory to get processed. And they sometimes take up to 72 hours for someone to get the test result back. But we're hearing now that results are coming back much, much quicker. And sometimes it can take sort of 24 hours. So this is for people who have symptoms where they should be self-isolating at home while they wait for their test results. The second type of test, and you've become more familiar with that, and we've had a community conversation about that, is the lateral flow test, or the rapid test. And this is where they're doing it at the Friendship Cafe in Gloucester, and they've just started a new one at the Royal Agricultural University in Cirencester. And this uses a similar swab to collect the sample, but what's great about the rapid flow testing is that it takes only 30 minutes. However, you have to be absolutely sure this is not for people who have symptoms. This is for people who need to go out to work for whatever reason. They don't have symptoms, but they can go and get tested, and it will pick up positive cases, and then they will immediately go home and self-isolate. So it's picking up for people that aren't showing symptoms but do have to go out to work. And it means that people can then isolate really quickly, because they can avoid passing the virus onto other people. And as we know, 1 in 3 people do not show symptoms of COVID-19. So it's actually a really effective way of picking up those cases that are not showing up because they don't have symptoms in people. And then the next one is, as the point says, it's really important to self-isolate when you do have symptoms, for when you're waiting for those test results, and then when you get a positive test result. Or, of course, if you've been identified as a close contact of someone who has tested positive. And by that, you could get a call from NHS Test and Trace, from the local authority, from Gloucestershire County Council, who are also doing some contact tracing. And then the fourth one is to get vaccinated. So that's another way of keeping communities safe. And obviously we're going through the list of groups. In Gloucestershire, we're currently focusing on groups 4, 5 and 6 of the list, and I can show you the table at the end. And that's, you know, once you've been contacted by your GP, please do take up that offer, because that's another way of keeping the community safe. And then the final one is what we've all been hearing for so long now, is just to keep up the guidance, keep up following the rules around hands, washing hands, wearing a mask, and keeping up the social distancing. And even if you've tested negative or you've had the vaccine, unfortunately, we still have to follow that guidance on hands, face and space. I thought I would put it into a star to help, just to sort of reiterate the message. So the first one, if you click, get tested when you show symptoms. The second one, if you are a critical worker or cannot work from home and are not showing symptoms, go to the Friendship Cafe and access those rapid tests. The third one is self-isolating for 10 days. When you get a positive test result, you're showing symptoms or you're waiting for those results, or you've been identified as a close contact of someone who has tested positive. The fourth one is to get vaccinated when you get that contact from your GP. And then the fifth one is to follow the current guidance on hands, face and space. Now, I've spoken to a few of you, and I thought I would just reiterate the guidance around support bubble, because it did change the guidance in December, and it's quite difficult to keep up with the rules. We have to constantly look at the website and to see what the changes are. So I thought I'd just reiterate what it means to form a support bubble, because there are eligibility criteria for this. So first of all, it's for those who are living on their own and adult. You are also eligible to form a support bubble if you are the only adult in your household who does not need continuous care. Also, if your household includes a child under 1 year of age or was under 1 on the 2nd of December 2020. If your household includes a child with a disability who requires continuous care and is under 5. If you're aged 16 or 17, and this is probably, there aren't many people within this category, but they were added to the eligibility criteria, living with others of the same age and without any adults. And finally, if you are a single adult living with more than 1 or more children under 18. So those are the eligibility criteria for people who can form a support bubble. And the idea is to not keep on changing your support bubble, because every time you change, you're increasing the risk of the virus spreading. So the guidance really does say, try to keep to your support bubble, but there may be occasions when you really need to change that. And so the guidance around that is that you can form a new one, but you have to still meet the eligibility criteria, and so does the other household that you're forming a support bubble with. And the other household must not already be part of a support bubble, which they intend to remain part of. So you can't mix and match. You can't join another support bubble if that support bubble is already in a support bubble with someone else. What's important that if you do feel that you need to change your support bubble for whatever reason, then you have to treat your previous bubble as a separate household for 10 days before forming a new bubble. This is to make sure that if you have, for whatever reason, someone in your household may have caught the virus and you just didn't know, so that we are sure that that transmission isn't going to take place with your new support bubble, you've got to wait for 10 days before you form a new bubble with someone, with another household. And what's important to remember, that if someone in your previous support bubble develops symptoms or test positive up to 48 hours after members of the bubble last met, then you are going to have to self-isolate, and all members of your support bubble will need to for 10 days. And you cannot form that new bubble until you've completed that. So there are those rules still around support bubbles. So I thought I would reiterate that in case any of that is unclear. We do, if you want to take questions now, I'm very happy to answer them. I also thought it would be a good chance to find out, what's going on in the community and what others are doing to support the community through this difficult phase.
Can I just make a comment?
Absolutely.
It's Jan Lowe, one of the city councillors. Hello. The support bubble bit I have not heard at all, apart from the initial stuff about being a support bubble. All this stuff about changing and swapping, I don't think anybody has actually heard in the community. They swap and swap and swap and swap and swap and swap.
Yeah, it's funny because you're not the first person who said that to me. I think it's a really difficult one because there's all the eligibility criteria, and you have to keep on. People have got busy lives, and they don't want to spend all their time looking at the guidance and seeing the definitions of what a support bubble is. It's really important as champions to try and get that message across. And
you won't now. I mean,
yeah.
I'm in a support bubble with my daughter. I mean, I actually live in Cheltenham now, and we're in Cheltenham. But we would not have heard any of that. And I listen to the radio. I'm on the 5 Live talking about it all morning. That has not been said ever.
Yeah.
That you can't swap, or if you do swap, you have to wait your 10 days or whatever.
I mean, it's been on the website, but again, I agree. It's almost impossible to keep up. It's impossible to keep up. I do it for a living, but I can't expect everyone to do it. No, it's a good point, and it's something that I think we all need to be aware of, that we cannot expect residents to be up to date with the latest guidance, and therefore anything that we can do to help spread these messages and this guidance which came into effect in December.
I'm Kate. Hi, Miranda.
Hi, Kate. Yeah, we were in touch. Yeah.
So obviously we've just had a big announcement today, and we're going to have several changes over the next few weeks and months.
Yeah.
And I think what Jazz said is quite pertinent, about people haven't necessarily got that bit of information about support bubbles. It's really important, but also about the social distancing, and because currently and for the next week or so, we're going to still be under stay at home, only go out for specified purposes, and then it's going to change, and we're going to have children going back into school, and there will be, understandably, I think, perhaps a point there where people are not clear again what the rules quite are, and it will feel a lot more like, it won't feel entirely normal, but it feel another step towards normality. And how do we get that message out about things like, if you're taking your child to school, you can't have that chat at the school gates, you still must stay at home. You're just because your children see each other during the day at school, that doesn't mean you can then go to the park afterwards. And even I'm not entirely clear about what the do's and don'ts around that are, but I think this is the opportunity at this point to reinforce what people should be doing and what those changes mean, because I've certainly had feedback from a number of groups that they feel people don't they don't sit and watch the website. They don't have that detail in their head, and they find themselves in situations where they should be behaving differently, but they're not.
Yeah.
I think it's a really good point about going back to schools and their behaviours, that we'll need to work with colleagues in comms and work with the schools as well. You know, because I think you're absolutely right, Kate, because we, you know, it is almost like a return to not normal, but some, you know, but we're going to have to reinforce the messages that when you're walking to school, you've still got to social distance. You can't, you know, and even so, yeah. I mean, we've been hearing about some of that creeping back in anyway. So I'm working with colleagues in comms, and we're going to try and target particular groups and things, and working with the schools as well, which we've been doing all the way along.
Yeah, my name's Sarah. I'm the minister at Matson Church and St Barnabas sort of White City area. And I think the main challenge that we're having is that obviously people have experienced bereavement. They've not been able to grieve in the way that they have wanted to grieve. There is a real expectation that, you know, they can hold that memorial service, they can do that thing. They want to get married, they want to get their kids christened. And I think that there is a real fatigue setting in around these significant life events, and you know, it has been really hard to control numbers at funerals outside. It's been you know, and it's getting increasingly harder, and it's hard to speak out to people who are grieving, and it is difficult. So, and you know, as much as we can speak into these situations and keep these facts and figures easily findable, you know, things like those maps are great, and you know, to celebrate what we're doing, but equally to reiterate, we need to keep doing it. We need to keep doing it. We need to have that. So just feeding back really that there is a real fatigue that I'm seeing, you know, which is increasing. And I think there's hope that things were going to be back to normal again. There's a real disappointment that, you know, it is suddenly okay again.
And weddings and things, and sort of like something like June the 15th or something is the earliest date for that, isn't it? So
absolutely.
Another 3. So no, that's going to be supposed to. No, it's 3 flipping months. Like that.
Yeah. Yeah.
It is, honestly. Yeah.
Yeah.
So Miranda, can I just say, well, 2 things really. One is to say thank you for what the staff, your staff at the Friendship Cafe are doing. And I think it's such a relaxed atmosphere when you go in. It really does encourage you to go back and to keep it up. So thank you for that. But also it is what's encouraging people to go. And listening to what some of us have said about, there's only so much information you can absorb, you know, going online and looking at this and looking at that. But what I'm increasingly finding is important is having those individual conversations, you know, and being sort of like, you know, willing to say, you know, your experience. And I know a couple of instances where I told people what it was like to go up to the Friendship Cafe, and they've actually signed up and gone. So I do think there's a lot to be said for keep telling our stories. Yeah. And, you know, encouraging people as much as we can. And I think sometimes people think, you know, we've got to do a big thing, you know, get out to as many people as we can. But I think one of the best ways is by continuing to have those individual conversations, and they get passed round that way. Yeah,
we had, just talking of individual stories, we did have a case a few weeks back now where a nursery teacher worker went into the Friendship Cafe to get tested, didn't have any symptoms, showed positive, and because the team gets the result very quickly, we could immediately let the nursery know. And by the afternoon, the nursery had closed because they were all close contacts. Yeah. And the speed, if you think how a lot of the care home outbreaks in care homes, a lot of it was because they didn't get the test results back. And because quite often it's asymptomatic, so people who don't have symptoms, and then before they know it, the outbreak is across the care home because they haven't got the result back. And what the beauty of the rapid flow is that it picks up on those asymptomatic cases, and if you get that message out to all the close contacts, you can quickly, cut the transmission. And that's what's so important. The more we can cut that transmission, the sooner we're all going to be out of this. And it is those individual stories. And it's really good to hear that you had that they're friendly people, that it works very well. It's a smooth process. And it's all over in a matter of within an hour, I understand.
Oh yeah, it depends how quick you are on your texting your information.
Yeah.
But yeah, it is, and I think because the team is like pretty much the same, you're comfortable because you know you're going to see familiar faces, and you know after the first time you don't have to rush, and you know if you're stuck somebody will help you.
Yeah.
And it's that's what encourages people, isn't it, to keep up with stuff.
Can I just come in with a question? It's Bob Allen. The biggest success seems to be in the vaccination programme.
Yeah.
And that seems to be a major breakthrough. And obviously Gloucestershire's done very well at getting it up and running and fast tracking it and everything. So that's brilliant. Is there two questions. Is there any evidence that Matson and Robinswood and White City are not taking up the option? Is there any resistance to it in our ward? And secondly, is it going to make people think that they can do what they like after they've had one jab? Because I get that impression. Oh, I've had my jab, I can start, if only they'd opened the pub, I'd be down there, that sort of thing.
Mm-hmm.
Any thoughts on that?
Can I answer about the data, Miranda? We haven't seen the data at a ward level. There is a group looking at it and things, so we could ask them to have a look and see what what the take up is in Matson and Robinswood in terms of those that have been offered the vaccination. If you felt, but I haven't heard any feedback to say that. I think generally across Gloucestershire, I think it's at 94% the take up of the groups 1 to 4.
Yeah.
Okay.
So it's a bit, yeah.
There were a few grumbles at one of the meetings about the fact to get to
Rosebank.
you had to do 2 buses.
Yeah.
And if you were 80 plus, that was difficult. There was that originally. I mean, I presume it's better now you're into the 60s and the 70s, and it's not so bad. But yeah.
I don't want to sort of rush people along, but equally, Jan, Tom, and I certainly have another meeting to go to soon. So, what I think we're interested in is what can the community do, and what can you do to get that focus on what people can and can't do in the community out. What's the best way of doing that? I suppose I might have some ideas, but I'm sure other people here do too. And what as a result of this meeting are we going to change about what we're doing?
Thanks, Kate. I guess I wondered if we could hear, because Vanessa, particularly from the Rebel Centre, they've been doing some quite targeted work, and I wondered whether she would talk a bit about that and how that's worked and how that's been received.
Yeah, hi, hello, Vanessa.
Hiya, Vanessa.
Hello, everybody. That's really thrown me because I can see a big picture of me. It's not a good moment. It's not a long day. Right, what have we been doing? We've been making it personal. We decided at the Redwall Centre that you've got to make this COVID thing personal, so that everybody understands why they're doing it and who they're doing it for. So we've done a lot of stuff about Matson versus COVID, Matson wings. We've done it in black and white, which is the rugby colours, blah, blah, blah. And we've kind of made it very personal that you've got to look after your neighbour, you've got to look after everybody else. We had a big thing at Christmas about A4 Seg Club opening up for Christmas and giving half of Matson COVID, which in fact at the time was like absolutely horrendous. But it also gave the people what we're ignoring or what we were trying to do. They then realised how bad this could be. Half their members ended up in hospitals and all the rest of it, and people that thought they would just cruise through it were really, really ill. So all of a sudden we had another sort of surge of, oh my God, this is really real. And the people that were against it are now up and running and doing it. So I think the combination of the two things, the Matson versus COVID And my thing for that was, you know, if it was my grandchildren, what were going to become really, really ill, I'd eat my dinner with a mask on. I'd be washing my hands all the time. So for me, it was a case of, you know, this is it. This is what it's all about. I've got to keep, you know, my family, my neighbours, everybody sort of like, you know, safe and stuff. And if that's what it takes, that's what it takes. And to be honest, it wasn't really nothing big, was it? Do you know what I mean? It wasn't like something that was really hard to do. I think some people found it a little bit going against their sort of rights and so on. But as I tell them, any human rights and all the rest of it went out the window when COVID moved in. Because, you know, that's the thing about it. So, you know, when people walk into the shops and they've got no mask on and all the rest of it, you're killing people. And you just got to come down to the real basic stuffs of that. The hard facts that if you've got it and you've walked in that shop, you could have just killed at least 3 people in that shop, which sounds horrendous, but that's exactly what was happening. So anyway, so we at the Redwall Centre, we brought it down to being personal for everybody. So, and we've put banners up, we've done badges, what say Matson versus COVID, please stay 2 meters away from me. No, please keep 2 meters of distance between us, you know, saving each other kind of thing and stuff like that. We've done hats, we've done bags, we've done, you know, anything that's out there with it on. We've done campaigns on Facebook and all the rest of it, just to keep it as personal to Matson as we can. We can't save the world, but we can actually work together and save the little bit that we live in. So that's what we do.
Thanks, Vanessa. That's really helpful. Has anybody else got anything they wanted to say about what we've been doing working with the community?
That's better.
It might keep switching. I mean, I guess what I could say that we could offer, Kate, in terms of the way we've worked, particularly in Barton and Treadworth, with was helping to produce things such as we've done audio translations in Barton and Treadworth. We've done leaflets, particularly targeted, and leaflet drops and posters and that kind of thing. So we can respond and help and offer whatever you think is appropriate. You know, will basically be paid attention to by the community, because there's pointless dropping leaflets through doors if people are just going to put it in recycling straight away. Let's be honest, you know. So it's kind of, you know, we can work with you, and also we can work in with our comms and making the messages just more plain English and easy to understand, because infographics work really well. I mean, there's stuff that Public Health England produce and stuff, but we've done local stuff. We can also do stuff like do it for Gloucestershire, you know, audio, social media recordings and things like that. Again, if you think it would be, you know, paid more attention to if it's very local to Matson and Robinswood, we could you know, look at doing that.
Well, yeah, it kind of depends. So it depends where you are in Matson, because I mean, obviously Vanessa's campaign and stuff was very effective amongst sort of that end, but a lot of people in the ward wouldn't recognise themselves as living there. I don't think I've said anything that anyone in Matson would disagree with. So it's about getting it out across the whole community, I think, and maybe in some of the places, because you know, where different organisations have reach into, and we've got a number of them, and I think Miranda's now aware of the partnership which Bob chairs, and how that links up together all organisations. But I think it is partly about what we're saying, and that initial, you know, let's do it for Matson versus COVID, that's a certain kind of message. But what the feedback I'm getting is it's that detail of understanding that you can't go to your nan's on Monday and then your grand's on Wednesday and then Auntie Ethel's on Friday, you know, because you just can't. And just because your child is in class with another child, that doesn't mean that they can go and play with them. It's those kind of really clear, you can't do that. I mean, I've just looked at the new guidance for the coming out of lockdown pathway, and now I know I'm not going to see my mother or my youngest child before the 21st of June, because that will not be possible for me legally to do so. And I think, you know, it's that clarity of what we're saying, and perhaps, you know, try and expand the range of places. I don't know if if Tom was telling me something about the bus.
Yes,
Yeah, I wanted to ask about the #1 bus, because I don't, well, obviously I don't go out apart from to go to the shop occasionally, but the one time I do venture further afield is I do my nan's shopping on a Friday, and the #1 bus, it's the most frequent, and it serves a lot of places. So if you're in town but you're not from Matson, say you're from Barton, you might get on the #1 and get off in Barton because it runs much more frequently than the other routes, and it serves lots of different communities. And I just wondered if there's a dialogue with Stagecoach or whoever going on, because I really think a lot of spread may be happening on an enclosed environment. Quite often the windows aren't kept open like they should be. It's always been a busy bus. Like before COVID, it would be standing room only and not really any standing room. And now, although obviously it's running at reduced capacity, it's still by far one of the busiest bus routes. And it's been so bad at some points that I've had to get off and walk halfway through my journey because I just don't think it's safe. Mask adherence can be very hit and miss with no enforcement. And obviously there are lots of things that you touch, and so I just wondered if there'd been any thought put into that, because I said a lot of people do use that, and that's not only going to impact on Matson, it's going to impact on neighbouring communities, because people will get that bus because it's in, rather than waiting 20 minutes for the #2 and then walk the difference.
Thanks, Tom. Well, I don't know the answer to that, but I can ask my colleague at the County Council, who is the commissioner for Stagecoach and has been working with them, and because I'll be in a meeting with him tomorrow, so specifically ask about that route.
Thank you.
Yeah, and I think the other thing there as well is that people know the people on the bus.
Yeah.
And I mean, I know that, you know, pre-COVID, Tom always picks up his casework on the bus because they go, "Oh, you that counsellor?"
Yeah, and that still happens, and it is really difficult to keep constantly having to move away from people who are then constantly moving closer to you, because there is no way of doing it without appearing to be rude, is there? So I think, yeah, that is an issue.
Yeah, so it might be something around bus stops, or it may even be the occasional, you know, having some of our COVID marshals, you know, travelling on buses and talking to people about what they should and shouldn't be doing from a safe distance.
Masks on properly in buses, because the number of people who keep their noses uncovered is ridiculous.
Yeah, I mean, the thing about the COVID protection marshals that work for the City Council, I think about linking with, I mean, again, that's another part of that conversation around the buses and things. I don't know whether they do actually have had any feedback around the bus route, so I think we could pick that up as well, Leanne.
Yeah, I'm happy to feed that back down.
Thank you.
Can I bring us back to, sorry, Bob.
Only to quickly say that we introduced, with Leanne's help, some banners to go around at food drop-off points, because that was one of the areas where people congregate, and if you're not careful, they dive in close together, forget all the rules, forgotten their mask and so on, don't sanitize their hands. And so we've been trying to, so we produced some banners which are encouraging to do that. I know it's only a banner, but it's just one of the places on the estate where, and it included Podsmead and other places, Tuffley, where there is a lot of people just gathering around and they forget the rules. That's all I've got to say on that, really.
Thanks, Bob. Sandy, did you want to ask a question or make a point?
I just wanted to bring us back to Bob's earlier statement about people that are having vaccinations. How can you make it very aware to them that just because they've had a vaccination, it doesn't mean to say that they're safe?
Again, I think it's back to the comms to remind people that, because you know that it doesn't make you safe. So I mean, we try and put it on all of the materials and things, but I think we're just going to have to keep on repeating it, because that is the case. And I don't know, Miranda, have we got anything else to add?
No, I was just, I mean, I guess it's down to what, I mean, I remember Sandy talking about this yesterday, and my thought is, how do you think we should get people or remind people, because you are the ears and eyes of the community, you know how they communicate, you know how they share stuff, you know how they think. What would be your advice on how to get the message across?
I think for me, it's that story-based approach you were talking about earlier. I mean, that story that Pat shared, I mean, if we could get that on our comms, you know, as well, you know, stories of people that have had an experience, you know, local people, I think that would be helpful.
Yeah.
I think it would be good just to talk to people as well. I mean, I myself have just had my vaccination, and they made it clear at the time that it would take at least 3 weeks to kick in. But even then, you've still got to follow the rules. But a lot of people don't actually listen to that part. They literally get their jab and then they're near enough gone, you know. So I'm thinking maybe talking to people, constantly reminding people when they say, oh, I've had my vaccination, just make it clear to them that as much as you've had it doesn't mean to say you're going to be 100% protected.
I wonder if there's a case for a bus stop campaign, every bus stop on the #1 route having a reminder that just because you've had a jab, you can still pass it, you can still catch it, and you can still pass it on.
Great idea.
And so, Sandy, would you feel comfortable, because if you had the right, I don't know whether it was a leaflet to support you, would you feel comfortable as a community sort of activist, someone who, you know, a community development work, would you feel comfortable having that role to try and spread the word?
Yeah, I definitely do it. Yeah.
Yeah.
You were saying that word of mouth, and you know, people have influence. There are probably people in the community that have a lot of influence over others, and it's how to get them with those messages and persuade them to share it and to be those people who influence.
Definitely.
But I think we've all been doing that. I think I mean, I went out for a walk before this meeting, and there's lots of people, the sun's out, a lot of people are out walking. I think somehow we need to remind them to stay safe, you know, to stay protected.
Mm. Yes, so I think, Bob, you mentioned those sort of pinch points where people are coming to collect food, or maybe we're handing out, you know, we're going to have craft packs and stuff going out.
Yeah.
And maybe, you know, around the school gates, you know, what can we do about reminding people at those points about what they need to do, as well as the buses? And yeah, I think at the end of the day, sometimes it just comes down to someone actually saying something. And I don't, you know, sometimes we shy away from it a bit, but actually saying to people, you know, you need to keep your distance, you need to put your mask on properly, you know, in a very polite way, and maybe a bit of sort of support around doing that each other in those situations. And no one wants confrontation, and nonetheless, no one equally, as Vanessa says, wants to go around killing the rest of the community because haven't quite followed some guidance.
The difficulty is putting out bits of paper and things. You can't do that at the moment, can you, with sort of advice on it? So it's tricky.
I think the county council's allowed to. It's just political leafleting.
Yeah, I know. No, well, I was just going to say about Sandy. You know what she puts on her leaflets.
Well, we have different leaflets. We have GL Communities ones. We have the Fair Shares ones. We have all sorts. You know, we can also,
yeah.
Can I just ask
something on the back?
Yeah, can I just ask, where's the bus company? Where do they come into this? We seem to be taking on everybody else's role. So where is the bus company in this? Why are not putting up posters and things on their buses saying you must get on with the march, you must stay 2 meters away? We can put things on the actual bus stops. We can do if you're riding on the buses. Or whatever, this is, you know, what we think that you should actually sort of look out for and be safe with. We can do all that, but I think we need to sort of partner up with the bus company as well.
Yeah, I would agree with that. As Tom said, one of the issues is they've marked the buses up with a sign saying alternate seats, but nobody takes any notice.
No, they just sit on.
Just sit on, and they don't always wear masks.
Yeah.
When the buses first came in, we happened to be in Torquay legally. The hotels were open, and they wouldn't let you on the bus without a mask. That doesn't happen here.
No, exactly.
And the other thing is that you know, people just they take no notice. They just seem to ignore it. And the other thing I was going to say was I've only once been on the bus where there's been an inspector on who's said, "I'm sorry, the bus is too full. You'll have to wait for the next one." That's happened once in 6 months. I haven't seen any extra help. And do they ever clean them apart from overnight? I doubt it.
Hi all. Hi Vanessa. Hi everyone.
Oh, hi Alistair.
How you doing? All right? Yeah, I think that's a really valid point, Vanessa. It's like trying to do the job for the bus company. They're getting paid. It's for their insurances to risk assess it, and really they should be putting in sort of barriers on seats to ensure that there is a safe distancing on the buses. I was on the bus today, and there's seats allocated for safe social distancing on the bus. You had to hand sanitize before, and you had to wear a mask. And then you had to get off the nearest seats as you're getting off in the same stop. You had to get off and wait for other people so you maintain social distancing on the way off. So it seems like maybe the bus companies haven't done any sort of correct sort of risk assessments. But another way to look at it as well, this is sort of a two sort of system issue, is say you've got 100 seats on a bus, and to social distance you need to get rid of, I don't know, 50 of them. So you've got 50 seats left, and you cover over 50 to make sure people social distance. You then got also the risk of that is everyone's sitting on the same seats, when normally you wouldn't be sat on those seats. So you've got the risk of contamination and spread from that contact, because you're going to be sitting on the seat somebody else has sat on, because the other seats are marked off not to sit on. Does that kind of make sense?
Yeah.
So it's sort of like it's like a lose-lose in that respect.
Yep, I agree.
So it sounds to me like there's two issues going on here. There's one is the bus behaviour, and the number one bus, as we know, is a really, really busy bus because it's got such a great direct route, and we need some help from Stagecoach to manage that. But they're also, when we were talking about the vaccination stuff, people are really confused. We're all a bit confused as well. There's information that we've heard tonight that we maybe didn't hear before. I think the vaccination stuff needs to be like almost a discrete campaign, as in completely separate from any of the other ruley things. So there's no point kind of going, oh, now the rules are this, and this, and don't forget, if you haven't had your vaccination, you must, well, if you have had your vaccination, you must still follow the rules. We need to make it really clear. If you've had your first vaccination, you still need to follow these rules, so that it's speaking to the person who's just come out of the health centre, the doctors, or wherever. I don't have an awful lot to say, but of suggestions, but I just think we need to keep it really clear.
Yeah. The problem is, I mean, from stuff that's come out literally tonight, they're now saying that both the Pfizer and the AstraZeneca, after one jab, is something like 98% effective, which is really going to confuse the issue. Because
I think we have to just press with what the guidance is, which is even if you've had your second jab,
you're still going to have a week.
You still have to obey all the rules.
Yeah.
So you know, but I think what Mandy said about just not confuse the messaging. So we want some really clear messaging about social distancing and social bubbles, so people can understand what they should and shouldn't be doing, especially now the rules are going to change. Yeah. And we want that across a range of organisations. I think we've had some really good input and offers tonight on that. So I'd really like to see some of that. And then a separate bit of messaging, which is probably more city or county wide, about is if you've had your first and second jabs, that doesn't mean the rules don't apply. Because you obey the rules for other people, not for yourself.
And you need a really good reason, and that's the reason, isn't it? If you see what I mean, you've got to make it clear why you're saying that, because otherwise it just feels like we're still trying to be controlling.
And that's why really easy, understandable information, really, really great, really attractive, really instant, you know, to be able to hand out will be really helpful.
Okay, well, you've given us lots of ideas and things. Oh, so Ray, did you want to come in?
Sorry, I just wanted to ask, do we think that a leaflet about support bubbles would be useful, or do we not be useful?
Yeah.
Yes?
Yeah,
absolutely.
Bubbles and distancing, so the stuff about the schools and the you know, play dates and all that stuff.
Thank you.
Thank you. That would be really that would be really, really helpful. Thank you.
I would think if they were distributed at school by schools, that would help, because that's going to be a big issue when they reopen and you've got 480 children coming out at the same time. or 1,000 children or 700 coming out of Gloucester Academy or wherever. That's an issue.
I think play parks are an issue as well, because obviously nobody goes around cleaning the parks in between children playing, and it does encourage people to, I mean, I know for a fact my kids, if they went out and there was people playing in the park, they'd just go and play with them. You know, it's making it easy to understand for children as well that, you know, parks aren't as good a places to be, because obviously nobody's there cleaning it in between different children, and obviously making them aware, even though like Kate said earlier, the other way around, but with the adults, you know, when they go to school and then with all the other children, they need to be made aware, the kids themselves, that that isn't what they should be doing outside of school either.
Yeah, so, and also not to mix with other children in the park, that kind of thing.
It's very difficult, isn't it? Because what they do at school is not going to, they'll still think they can do it after school. What is the, you know, and then it's medically, I think children, particularly primary children, are pretty low risk, aren't they? So who knows?
But not low risk for spreading. They're super spreaders.
Yeah.
So Miranda, is that helpful? Is that where you wanted to be today?
Yeah, I mean, I think it's really good to hear your ideas and how the community feels they can be supported. I'm keen to, you know, this concept of how to involve community chambers, how we can support people in the community to follow the guidance. And, you know, I think what came out very strongly, certainly speaking to Sandy, but, you know, having you know, knowing how communities speak to each other, how they share information. I mean, I think, you know, the role of people who have influence in the community is really important. And yes, I think that having things on bus stops and, you know, posters on buses, yes, they're all nudges, they're all reminders, but I don't think you can beat an influential person in the community in terms of, you know, sharing the guidance. And I think what I would like to see is how we can support those members of the community who do have influence reach the people that need to be reached. And I think that the idea of stories is a really good one. I think stories are incredibly effective. And I wonder if we can somehow tease out more stories from the communities themselves and then use them to share with others.
I think one thing that was really successful was we have a member of our church family who is a nurse practitioner, and he just came to share his experience, and that did so much more than anything else. Exactly. This was online, you know, on Facebook, on YouTube, and I had so much feedback. We had so much good feedback about that, and that sense of, you know, we're doing it for him as well. You know, we're doing it to help and support his work. And I think it is hearing those stories which will make all the difference. I really do.
And so how do we get those stories?
Yeah, well, I'm sure he'd be really willing to come and talk to you guys, but you know, he's in Tuffley, but you know.
Yeah, and I think you know, as local councillors, you know, we're happy to lend our voices to anything you want. And, likewise, yeah. I mean, and yeah, Tom lives in the heart of Matson. He's just said he doesn't go out unless it's for the specific purposes, you know, and it's just about that simple. You know, he's a young man, reasonably good health, and there's no reason why. Yeah, he's certainly in a category where people might think I can take the risk, but he doesn't take the risk because there's his nan. He's got to do her shopping, and so he keeps himself safe and he keeps her safe.
Yeah.
There's Raymond's involved in this group, and he works in the NHS, the hospital, and I know he's his workload's increased significantly. So maybe he could say a few words if he's happy to.
Hi, good evening, everyone. I work as a nurse at Gloucester Royal. I've been a resident here in Matson for 14 years now. I'm also active in the voluntary organization, chairman of the Filipino Association of Gloucestershire. Many of our members are working as nurses. Yeah, so I've seen the numbers climb really while working in the hospital, and as nurses, we were constantly kind of hoping that the message would be picked up by everyone, because we see it happening right in front of us. It's good that we have Minister Sarah with us this evening, because the other point which I'd like to really emphasize is, and thank you for having me here as well. It's my first time to be in this particular portal. Awareness, promotion of awareness is really key. I know that apart from Minister Sarah's church, we also have the Baptist Church. We also have the Catholic Church. We have all the other churches. Maybe we can also tap them and help them kind of impart the message, so that at least we can inform more people. I think vaccination is really, really important from a nurse's point of view. The more people who get vaccinated, the more that we can be all protected. And I agree that even after full vaccination, nobody is invincible. That would remain the case, unfortunately. At one point, we even have been talking about, even with full vaccination, we can still be spreaders. There are studies after studies which would offer a lot of messages, but it's quite clear. The government is quite clear when they said that regardless of vaccination, all precautionary measures should remain in place. And also, the other thing is getting tested as soon as the symptoms surface is really, really important. And thank you for the Friendship Cafe, because they're there to offer us this kind of service. So those two really, getting vaccinated, getting tested as soon as the symptoms come up, and also the hands, face, and the space reminder. Thank you very much.
Great, thanks Raymond, really, really helpful, really important to hear your voice.
Miranda, am I okay just to say a bit, hi everyone, for those that don't know me, I'm Leanne Purnell, I'm a Community Wellbeing Officer with Gloucester City Council. If we do have any of those localised ideas similar to the Matson versus COVID, or the share food and friendship, not COVID message that's gone out from those sort of, the food points, we do have some compliance funding. So that can be, I've shared the link in the chat to have a look at. So if we do have any of those localized ideas that we want to enhance, we are able to support that. Or whether that's not just around the compliance, so we do sort of move it into the messages around the vaccination, that's a possibility as well. So to make you aware.
Excellent.
Just to say, I've got.
Di, I was just wondering, did you want to share some of the questions that we were hoping to sort of get out of any insight that's done?
Share. Sorry, do you mean share tonight, or we can share them with because everybody signed up.
Yeah, as we some of us have got to leave now because we've got another meeting. So could you share those with us by email?
Absolutely,
yeah. It's the perils of being a councillor that you always have 3 meetings at the same time, I'm afraid. So some of us do have to go. But I think we've. Are you happy that we've got a reasonable plan going forward?
Yes, definitely. We've got a plan, and those of us that are working in different areas will come together to try and take them forward. And we've got your contact details now, and so we'd like to be able to continue to work with you as sort of COVID champions, and we'll send information out as we produce it. Is that okay?
Yeah, thank you, and thanks everyone. That's been very interesting.
Yeah, thank you. Thank you.
Thank you. I need to go as well. Thank you very much.
Okay. Thank you, Bob.
Thank you very much.
Hello. Hello, right?
Hi. What I was thinking is about getting the message out, and a few people say there's like local stories and local people that could give a message that people would know who these people were. Is it worth sort of, rather than just doing leaflets, it's probably safer to put a video out? I'm happy to sort of try and edit one, and one that everyone would be happy with. Not politically in any way, just basically getting stories out and explanations of what we can all do together in the community to sort of fight coronavirus as a community, and not make it sad, sort of get some stories behind it, but make it a happy kind of positive vibe. Sort of bringing everything on to simple things on the bus, pre-engaged stagecoach, to collecting children from the school, and even going into the shops, just like a little explainer with some sort of like some hard-hitting sort of bits behind it, but with an overall positive sort of outcome that we could all share and sort of put together, if that makes sense, something that we could do quite quickly. Yeah. Obviously, I'm happy to help film it and edit it. I was just wondering if there's anyone else on board that would be happy to meet up, like obviously socially, responsibly, and get together with me and with a couple of people that are interested in telling their stories locally. So you'll be available, yeah?
Yeah.
All right, Brendan, do you know any people's names you could put forward maybe for this?
Yeah, I know a few. I'll speak to them tomorrow and I'll let you know.
And obviously Raymond, if we could have some sort of bits from you, would be amazing with the NHS and how it's affecting you sort of in your workplace would probably be good. And just, I don't know, am I speaking out of term here, or is this okay what I'm suggesting?
Sounds absolutely brilliant. Yeah.
So even from the church, Sarah, if there's somebody from there, obviously before it goes out to press as such on Facebook, everyone that's involved will have, like, I don't know, a little screening through Zoom or something.
Yeah, we've got Facebook and YouTube channels, so we can pop it up there.
That'd be amazing.
Yeah, of course. I'm very happy.
We could all log in and just check everyone's happy with the editing before it goes out.
Yeah, that's great.
That way everyone gets to see it, and anything else anyone thinks they can add to it, we could do. It'll only be a sort of short video, I know, like a minute and a half. We don't want it too long where it's going to bore people.
Sounds great.
Cool. So I'm not sure how we go forward of getting sort of people together.
I'll just message you my email address after. Right.
Thank you very much, sir. That's great.
Can we just find out why the bus drivers, they're not wiping down their services when they hit their last stop? Like once they're in town, they need to wipe it down, and then when they get to the last stop, wherever in Matson, to wipe it down again. I know they can't do it every bus stop, but do you know what I mean? At least that goes some way of doing it.
What I would have thought would be really good, but it's sort of the environmental issue, is they've got those like plastic sheets you put on chairs, you know, when you have your car balloted.
Yeah.
And you could get one of them out of the container, you know, whip it. A fresh one comes up like toilet paper, if that makes sense. Where
yeah, I know what you mean.
And you could put that on, sit on it, and then take that with you and fold it up. And you could use that next time you sit on the bus if you're a regular user. So it's not like it's like a throwaway item. They fold up pretty small. And that's something the bus company could kind of provide users for the bus to sit on, if that makes sense.
Yeah,
I don't know if that's a good idea, but again, it comes down to costs. They might even be like 0.001 of a penny, but if you've got thousands and thousands of them, maybe it's something the bus company might not want to do. But I think they've got to be sort of called to task on their risk assessing, because it seems like they're not maybe being fully compliant and putting potential community at risk.
But you can get like paper coverings now that go, so they can just be recycled. You know what I mean? So there's no excuse for that, because you get the paper material ones that you can just recycle. But what I'd like to see them do as well is wipe down the wipeable sides, the handles, the bars, and all that. Because I mean, that's when people are on the bus, they're always holding the seats or holding the bars. You know what I mean? So I just think they should be held accountable for that and start doing things like that.
I don't know sort of like the processes of who would bring them to account and ask them to relook at their risk assessments. I don't know how to go about that and who to challenge on that. That's the only thing.
I can raise it with environmental health colleagues here at the City Council. We've also got the city protection officers that are doing daily visits of the Matson shops, Coney Hill Parade, those sorts of areas. So if there are concerns, I think there was an earlier suggestion about perhaps the CPOs maybe, you know, doing a few bus rides to actually witness some of those issues. So I'm happy to take that back to colleagues in community health.
Thanks, Leanne. And I can talk to my colleague at the County Council who commissioned Stagecoach, because there must be protocols and risk assessments they're supposed to have carried out. But so I can talk to him. But I think actually gathering some evidence would be helpful if the COVID protection officers are able to do that. Vanessa.
When you go in a shop, you've got to put your hand cleanser on and clean down all your trolley and all the rest of it. Why don't people have to put their hand cleanser on and all the rest of it before they get on a bus? Do you know what I mean? Why are the bus not going? Why is the bus not going before you get on there? Squirt that in your hand or whatever. And again on the way out.
Yeah,
it's a great point of that.
Yeah, my friend gets buses all the time to go to work into town. I'm not funny, never to the Matson #1. And she squirts before she goes on, she squirts when she comes off, she gets to work, she washes her hands, she gets home, she washes her hands. Do you know what I mean? So why is nobody actually going to everybody else? Squirt, baby. Do you know what I mean? Just get this hand thing on. Because I've got to do it when I go to Asda's or wherever. So just a thought there, Alistair. Go for it.
Good point, Vanessa.
Raymond, too. Yeah.
Just one final point. Coming together as a community, and this might sound quite ambitious, but I know of several people who actually work as nurses and ACAs in Gloucester Royal who live in Matson, like me. So I may be able to speak to some of them and ask them or tap them, invite them to join our group, so that at least we can, have more health workers within our small group, and hopefully it might result in something very positive. Thank you. I'll try my best.
Thank you, Raymond. Yeah, that would be great. Okay. So are there any more questions? I think I want to bring the meeting to a close so we can all go and watch the announcement or get something to eat or do whatever. Just to say that if you do produce anything, and if you want colleagues of ours from public health or from comms to look at things, do send them through to us, because we can make sure that that the messaging is correct and accurate and following the Public Health England advice, because we wouldn't want to put anything out there that is not confusing things more. To be honest, if we put misinformation out, then that can cause even more confusion. So we're happy to do that, because we can feed that to our colleagues that we're working with at the County Council and at the City Council, of course. I'm hoping that you all will want to continue to work with us as COVID champions, and that we might convene another meeting in a few weeks' time when some of the guidance is further developed and we can better, and also we'll see what the issues are that are presenting then. Would you be happy to do that? I'm seeing nods, so I'm taking that as a yes. Okay.
Yeah, no worries. Thank you.
Yeah, that's great. Okay, thank you very much for giving up your time, and
thank
stay
you.
safe and keep washing your hands, space. We're all good. Yeah. Thank you so much.
Take care.
Thanks, everyone.
Thanks.